Healthy teeth are vital to reducing many medical problems, including heart disease and stroke. Well, access to good dental care, no matter your financial status, is being taken a step further thanks to MUSC. Joining us is Dr. Theodore Ravenel, Director of Postgraduate Endodontics at MUSC's James B. Edwards College of Dental Medicine, and Dr. Rachel Chen, second-year resident of Postgraduate Endodontics. It's good to have you both with us today.
Thank you so much.
So endodontics, let's just start there. It's not a term that we hear a lot very often. So Dr. Ravenel, what exactly is endodontics?
So endodontics, I guess if you look at it, the ADA has 9 different dental specialties. Most people know of like the oral surgeon, you get your wisdom teeth out, the orthodontist straightens your teeth. But endodontics just refers to the inside of the tooth. So we do procedures that are related to tissue that's diseased, and typically that involves just a root canal therapy. So we're your root canal specialist.
And you're second year, but taking South Carolina as a whole, you know, we understand there are certain diseases that affect South Carolinians, such as diabetes and things like that. But in terms of dentistry, what are some of the common issues that you see amongst your patients?
Decay is very common, especially in this time period. Our diets have changed where everyone's eating a lot more carbohydrates. So we have no limit of patients who need root canals, because when a cavity becomes too big or too deep, it can actually start damaging the nerves and blood vessels inside our tooth, which is when a patient will need a root canal.
And that's why this program is so incredibly important, because you're also trying to preserve people's natural teeth in the process, right? And so why is preserving the natural tooth so crucial to the work that you do?
Well, just as far as we live in a very aesthetic society. So unfortunately, if someone were to have a situation where they needed a root canal in their front tooth, if you can't get the root canal, the only other option is to extract the tooth. And of course that would impact how they're viewed kind of socially, and might limit their kind of ability to get a job down the road. Just function, the ability to retain what you have provides the ability to, like I say, keep a healthy diet. And you know, by providing the service that we provide, like you mentioned, you know, endodontics is related to other systemic diseases that you can have. So cardiovascular disease, they're starting to find connections with, you know, endodontic problems with that. So the healthier you can be, the more you retain your teeth and remove disease from your body, the better outcomes will be.
You raise such an interesting point, because when you talk about needing a root canal, say in your front teeth, typically we think of the molars requiring root canals, and if you need to extract that, well, you don't really see it. But if it's in the front of your mouth and you talk or you smile, people are going to see it. They're going to perceive you differently, and it's not easy for many people to just say, hey, I'm going to go get cosmetics dental surgery and fix the problem and I'll look good as new, if not better than before. So that for the clients that you serve with this particular program, that's not so much of an option, correct?
Correct. Yes, so even if they are able to go and get that dental cosmetic implants, it does take, most of the time it takes several months to be able to make it look like a beautiful front tooth.
Yeah, indeed. Tell me about the partnership currently.
So the partnership originally started before the pandemic. We had started a rotation with undergraduate dental students to go out there on a Wednesday afternoon, and then patients that we had screened for straightforward root canals, we would take dental students and perform that. And that worked well for up to the pandemic. And of course the pandemic kind of threw a wrench into everything. Most dental clinics shut down for a time being. Since then, we've been trying to kind of get back, and so that's kind of where this outreach program kind of started. We had been in touch with the great people of Our Lady of Mercy, Dr. Franklin and her staff out there, and decided to bring the residents out there who are already dentists, and we could see a bigger base of people all in one day.
Yes, indeed. And how do you qualify?
So if you go to Our Lady of Mercy on their website, you have to fall below a certain poverty level that is basically you know, provided by the federal government. So if you go onto their website, I believe it's anywhere from 150 to 200% below that poverty line. And if you are a resident on the Johns Island community, I believe that you qualify for
Is there a wait list? Is there?
That I would refer to the Our Lady of Mercy people.
Oh, I see. Okay. All right. Well, we're going to have all that information up on our screen so that people can locate and put in their application. So this is a program that's now going to be ongoing. So now that we more or less have COVID in our rearview mirror, this is something that residents here can count on.
Yes, so we've got some tentative dates set up with Dr. Franklin. So we've got some in February and March and April, and we're going to get the students back involved as well, so they'll be able to help out.
Just real quick, as a student, how valuable is this experience for you?
It was a great experience because we were able to see so many patients in one day. We really packed those schedules. It was kind of a blur,
I'm sure it was.
but it's really given us a basis on kind of what to expect if we go out once we're practicing to maybe start a program like this of our own or spearhead that.
That's wonderful. I want to thank you both so much for sharing with us.
Thank you
so much.
We're back after this.